Hi everyone, it's Wednesday. Time for a little Wisdom Wednesday. It's been kind of a long week already with all the happenings in the world with COVID and the Delta variant. So I'm just going to touch briefly on that, in that we now have a mask mandate here in Dallas County, and we are seeing the hospitals filling up, particularly with not only COVID, but with RSV as well. So lots of sick folk out there, and many of the phone calls we are getting and testing positive are in patients with the vaccine. So just know that viral loads can be very similar in vaccinated patients as well as non-vaccinated patients. We are seeing significantly less hospitalization, certainly in vaccinated patients. So just sharing that information. But again, remember, it's about optimizing your immune system. We are doing some ivermectin for a lot of folks. There is a protocol for preventive or prophylaxis as well as treatment. I think for the vast majority of people, the treatment option is plenty. So you can certainly give us a call or a heads up if you feel like you are having issues and you test positive. This may be of some benefit, but again, just our basic anti-inflammatory and immune support protocol that we've talked about so many times here is where you start, and then we can work around all the other things. So hang in there, wear your masks for right now. Hopefully we'll be able to go maskless again soon, but right now I want everybody to be aware that we are under a mask mandate. Now, to switch gears a little bit, I wanted to talk about some testing that we have available as far as functional testing and micronutrient testing. We have a test called the NutriVal from Genova, and this particular test is quite helpful for helping people to understand sort of a deeper look under the hood, if you will, beyond what we normally do here in the office. I usually get a vitamin D level, which we know is quite valuable, and we want to keep those levels above 50. And we also check some B12 and folate levels, but we really don't get a huge, vast look at what is happening beneath the surface. So one of the tests that we have available, and we have several micronutrient tests, but I want to talk about the one from Genova, the NutriVal test, which helps us understand both with using blood and urine. We can get markers for 125 biomarkers, which assess vitamins and antioxidants and minerals, essential fatty acids, amino acids, digestive support, and some other nutrients as well. So this is a test kit that we can order and have available to you. We do need a first morning urine for this test. So why would you want to consider doing this test? Well, for people who have issues with mood disorders, history of cardiovascular disease, issues with weight and pre-diabetic, fatigue, which is a big one, which can help identify areas within the mitochondria that might be helpful. Weight issues, if you have malabsorption issues, a lot of GI issues, this type of testing can be very valuable because we get a huge picture of what is going on metabolically within the body. We get valuations for organic acids. These are the metabolites of what's happening from a digestive standpoint in the body. We can get markers for cellular energy and mitochondrial markers. We get vitamin markers beyond just vitamin D, B12, and folate. We get metabolites of neurotransmitters, so those things in our brain, serotonin, dopamine. We get some of those metabolites and can utilize that information to help bring more balance to neurotransmitters. We also get toxin and detoxification markers. In addition, they now have some oxalate markers, which can be helpful from a kidney standpoint with folks with stone formation. We get oxidative stress markers, which help us understand whether or not we need more antioxidants, glutathione, CoQ10, etc. We get essential amino acids, and what we can see with that is, are you deficient and can we help get those levels back up? And then we also get markers for our essential fatty acids, omega-3s, omega-6s, omega-9 fatty acids, in addition to saturated, unsaturated, as well as getting just a calculated cardiovascular risk. And then we can also add on certain things like genomics and testing for what we call the MTHFR gene, our COMT gene, ApoE, etc. We can add that on, as well as with this particular test, they are offering COVID-19 antibody testing with this. But this particular test can be really helpful for those of us that really are getting pill fatigue, taking so many supplements. Do you need this? Do you need that? Or how much or how little of this? But if we're still struggling, for those of us that are taking the supplements that we have prescribed for you, and you're still finding that you're overwhelmingly fatigued and struggling, we can really get a much better look under the hood, and then we treat, and then we retest. And this is a little bit more involved. Insurance, we can get some copay help with this, but these usually run somewhere between $200 and $300. Some of them a little bit more, depending on if we add on to it. So some of this may be out-of-pocket expense, but I do think that for many of us, having that deeper look under the hood can be of great value. So consider NutrVal testing. Let us know. We do kind of have to get a little bit of a head start on it, because we need to give you part of that test kit to get the aspect of the first morning urine, because you'll do that at home rather than having to come up here and try to hold that first morning urine until around 8:30 or 9. We don't want you to have to do that. So just let us know if this is something you have interest in. We'll be happy to help you. We do have other companies that do this as well, but I believe that the NutrVal for many folks can be a very beneficial test. You all hang in there, another week down in the land of COVID, and hoping that you're continuing to keep your immune system in good health. And if you do need anything else from us, please let us know, and we'll be happy to try to help optimize anything as far as your immune system is concerned, in addition to any pharmaceuticals. Remember, it's about getting good sleep, good exercise, stress management, lowering your sugar intake, trying to optimize your nutrition, as well as the supplements that we've talked about. All right, everybody, have a great week. We'll talk again next week.